Many people suffer from sleep apnea and have no idea that they are throwing up all sorts of red flags for sleep apnea. I think it's very important to familiarize yourself with the symptoms of sleep apnea, so let's dive in. Any amount of snoring is not normal. If you have frequent snoring, loud breathing at night, or if somebody has ever told you that you gasp or stop breathing at night, this is a concern, my friend. Do you sleep in strange positions, wake up easily or often, wake up tired and unrefreshed? Do you sleep restlessly or grind your teeth? Have you been diagnosed with sleep apnea before, mild, and aren't doing anything about it? Do you have frequent urination or night terrors, night sweats? Wake up with a headache? Do you have a large neck or are a little bit overweight? Are you being treated for hypertension, diabetes, heart disease, Alzheimer's, dementia, anxiety, depression, or chronic pain? All of these are symptoms that could indicate sleep apnea, and it should be taken very seriously because it is at crisis levels. It is not just a way of life. It could be part of the greater than $150 billion health crisis that we are experiencing. So we are here to help you find the root cause and also root cause resolution.